To restore vision, doctors sometimes put a tooth into the eye. It sounds like a medieval torture method, but it's actually a real surgery that leading surgeons have been performing for over 60 years. This technique, known as osteoodontokeratoprosthesis, can restore sight to people whose corneas are so severely damaged that traditional transplants are not an option. The procedure is incredibly complex and happens in several stages. First, one of the patient's own teeth is removed. It's used as the foundation for an artificial cornea. A small hole is drilled into the tooth, and a tiny lens is inserted. Then, this tooth implant is placed under the patient's skin, usually in the cheek, where it fuses with the surrounding tissue. Several months later, the implant is removed and surgically placed into the eye, replacing the damaged cornea. The lens inside the tooth becomes a kind of window through which light can once again enter the eye. Amazingly, this method can restore vision even to people who have been completely blind for many years. What makes this approach so effective is that the patient's own tissue is used, reducing the risk of rejection which can happen with donor corneas. Only a handful of surgeons in the world perform this operation, and only in cases where corneal transplantation is no longer an option.